This is the conclusion of a test between Genesis Ibogaine Center and Phytostan Nutraceuticals, a division of Phytostan Enterprises, on a patient with atypical Parkinson's disease. Can I have your name, please, and age?
Dean Kornstrom, age 71.
Today's date is December 3rd, 2014.
Hi, I'm Dr. Morales. I'm going to do some questions. I'm going to ask some questions to our patient, Dean. Dean, the first time that you had symptoms for Parkinson, how long ago?
Well, I was diagnosed with Parkinson's in 2012, and I probably had symptoms 2 or 3 years before that, so.
2 or 3 years before. Do you know what kind of Parkinson you have?
I've been diagnosed with atypical.
Atypical.
I don't have a palsy.
Mm-hmm. What medicine are you taking when you arrive to Genesis Clinic?
I'm taking Cinemet in a 50-200 time release.
Okay, and you've been taking these medicines since you were diagnosed with Parkinson?
Yes.
Okay, have you changed this medicine?
No.
No? Okay. Do you have tremors right now?
Do I have?
Tremors?
No, no tremors.
No tremors. What about saliva, drawings?
I had increased saliva before I came here. It has decreased since I've been.
Mm-hmm. Are you with depression I'm talking about during this treatment, the 24, 29 days that you've been with this medicine?
No, I haven't experienced depression.
No experience. Hallucinations?
No hallucinations.
No hallucinations. What about your speech, Dean?
My speech might be a little more improved with diction, tongue control.
Mm-hmm.
I'm experiencing some increased facial activity, maybe muscles becoming alive, that we're alive.
Mm-hmm.
So I think I could say that when I started out, the reason I was diagnosed was I had an immobile face, like a rock.
Okay.
And I don't think it's that way today.
Okay. Now, Dean, going back to drawing, what about, have you noticed any change on your drawings?
In
Your saliva, your drawings?
the seborrhea?
Mm-hmm. No, your drawings with the saliva.
Oh, the drool.
Mm-hmm.
Yeah, I have decreased drool since I've been here. It's lessened dramatically, actually.
Okay, it is significant, the change
Right.
that you have. Okay, confusion.
I've never experienced confusion unless I'm confronted with 5 or 6 decisions to be made instantly, and I don't feel any different there.
Okay, now talking about your memory.
My memory has been excellent all along,
Uh-huh.
from the beginning.
Okay, tell me, how are you improving with your handwriting?
Well, my handwriting's gone from when I first came here, it was very small and tight, difficult to write words out, to a much bigger, expansive, more free-flowing handwriting.
Mm-hmm. What about lasting? What about when you're handwriting or you're writing something, you last writing for a long period of time, or you get tired easily?
Well, I tire pretty easily, but I can maintain a consistent height now,
Mm-hmm.
and I can stay in a straight line.
The way you hold the pencil or the pen, it lasts longer?
Well, one of the first things I recognized after starting the treatment was my right hand started to come alive a little bit.
Mm-hmm.
Slowly it's been regaining my use, so I can hold the pen differently. I hold a fork differently now. I can use a fork and turn it and put it in my mouth,
Mm-hmm.
where I couldn't do that easily before.
Okay, that take me to the other question. What about you eating? What about when you start eating using your knife, your fork?
Yeah, before I got here, I was not using a knife very well with my right hand for cutting. My wife would cut my food up,
Mm-hmm.
and I find that now I'm just naturally eating like I did before. I'm cutting my own food, and
Mm-hmm.
so I don't need the assistance that I needed.
Okay, so talking about you walking,
I don't walk very far anyway because I have a degenerative disc in my lower back.
mm-hmm.
It's a separate issue entirely,
Mm-hmm.
and that's another problem.
Mm-hmm. What about standing up? When you stand up, it lasts longer when you're standing up?
Well, yes, I actually had an epiphany the other day where I was standing up
Mm-hmm.
talking to people, and I realized that I haven't stood up like that in many years.
Mm-hmm. Okay, you're doing pretty good, Dean. There's another question. Talking about your balance. Remember yesterday we were talking about balance.
Right, and the standing up had to do with the
The balance.
sort of a regaining of a sense of balance that I'd lost three years ago. Well, it's all sort of dramatic for me. The improvements. Anyway, keep going.
Okay. This-
If you talk, it helps me to focus again.
Sure, yeah, okay.
This
What
isn't
about
depression,
falling?
this is happiness.
What about falling? During this time, during the Genesis clinic treatment, have you fallen sometime?
No, I haven't. I felt like I could fall before, but my sense of balance now is much increased.
Mm,
I don't know if it's perfect because I don't remember what perfect is,
mm,
but I don't feel like I'm falling. I can walk up and down stairs,
mm.
and I do it here much quicker than I was able to do it before I got here. Even to walk across the street from where I'm living to this clinic was a difficult task when I first got here.
Okay. Let's talk about your hands, control hands. How do you feel that you have more control on your hands? When you reach something, when
I
you
can
get something?
reach. I'd lost my fine motor skill. I couldn't turn a screwdriver. And I can begin to do that now. It's coming back somehow.
Okay.
It's not 100%, but it's 30% better than it was.
Mhm.
40% better, I don't know.
Okay. Okay, now you said it before, but well, I would like to hear from you. What about your face? Your smiling, your muscles? You
My
feel
face.
sometimes, like 2 weeks ago, you told me something that you feel like some changes in your.
That was the first thing I noticed was the fact that my muscles and the surface of my face were regaining sensitivity.
Mm-hmm.
And I woke up one morning and I was smiling,
Okay.
which I haven't really done.
Alright, this is one of the other questions is smiling. Smiling, that means more action.
More emotion in my
Emotion.
face. I could feel my forehead crinkle, my eyelids raised. I wasn't doing that before.
Now, talking about eating, how it's the ability to use knife, forks?
Well, it's not 100%, but it's much better than it was before I got here.
Okay, we have some fruit. Would you like to show us how you use the
If
knife?
that's what will help you guys, I'll be glad to.
Yeah, please. Let me just a little bit.
I can smile on demand.
Here's your knife.
Before I had trouble picking the knife up and holding it with my hand, I would have to grip it like this. Now I can get it with my fingers. I can stick this in and I can cut. You can really, this is a soft product, but it's easy to cut. And then I can take the fork, maneuver it around. Simple stuff.
And that is one of the big improvements that you noticed during this period of time.
One of the ones I've noticed. Big improvement in how I can use utensils to eat.
Okay. What about, do you have any difficulty to swallow the food?
I've had difficulty, but it's never been a problem, so I don't know how to respond. The swallowing and the drooling and all that were kind of combined together, but I don't have any trouble swallowing right now.
Okay. And what about when you start dressing up?
When
You put your clothes on, your shirt,
I
your
have-
pants.
I buttoned this shirt myself today, and a month ago it would have been a very difficult task to grab a hold of that button and push it through the hole. So my dexterity with my fingers, the use of my fingers has greatly improved.
Alright. Okay, now, Dean, this is a motivation. How you feel doing this training? How do you want to say something to the camera to see in your own words how you feel about the treatment? What kind of improvements? Anything that you want to say? It's
Okay.
your time.
I've been thinking about it. I know we were making a film, but the improvements are, if I could say, mind-blowing. But they are mind-blowing, and I've been blessed, I guess, to come here. At a stage with Parkinson's where I just was uncertain of what was going to happen to me. And in researching treatments and different modalities and different opportunities, there are no opportunities. There's nothing available. And I'm old enough and been around enough, I guess, at 71, I'm ready to try anything. And the experience has been extremely impressive to me here. I feel a tremendous sense of there's progress to be made. I don't know what it is exactly. It's a sense that I can get back into my body again. I read in the New Yorker this last year by a fellow a story written about Parkinson's, where if you wanted to put it into a saying, he said he'd lost his edge in life. And that's how I felt. I understood that. It's difficult to explain what Parkinson's is, but you lose your edge. And I've gotten my edge back in a few areas. I have a, whether this lasts or whether this is a permanent condition or whether there's change, I'm willing to do whatever comes. But this has been a very rewarding experience for me, and in small ways to some, or like really big ways to me. So I'm anxious to see what happens next. And other than that, it's been a month-long study, and I can say that it has tremendously benefited me. I don't know if that's a value, a statement like that, but I'm willing to talk to people and be examined and whatever in the future. I did participate at UCSF in San Francisco in their Parkinson's clinic. The man who's short-term memory, I can't remember his name, Aronson, I believe, Amanoff, the head of the clinic, examined me, and he said, yes, I have atypical Parkinson's. And my doctor in Santa Cruz, California, Michael Ganzauer, he diagnosed me with Parkinson's. And I'm sure both of those doctors are available and have notes on what I've been like in the past. And I'm more than willing to have them. We'll see Dr. Ganzauer again shortly. And I'd like to see the availability of this product for my use in the United States. I guess that's all. Thank you.
Okay. Thank you, Dean, for your
Smiling.
cooperation. Thank you.